Hey, guys, this our lecture will actually cut across abdomen anatomy, and it will also cut across what gastrointestinal system in physiology. Okay, so today we'll be talking about three things. We'll be talking about the blood supply to the rectum. We'll be talking about the anterior relations of rectum. I'll also be talking about the posterior relations of rectum. Okay, so this is the rectum, and this is all about it. We'll be fast forwarding to talk about the blood supply, which is simple, and the venous drainage, which is also simple. Okay. So first of all, let's start from the posterior and anterior relations of the rectum. Okay. We'll be using this image as a guide. We say that the rectum is the most distal segment of the large intestine, and it is located within the pelvic cavity. Okay. Its anatomical relations differ between men and women. Okay. Now, in males, the rectum is related to the sacrum and the coccyx posteriorly. We don't really have a different model for males and female, but let's just try to relatively. Okay. So down here is the coccyx, and up here is the what sacral bones. Okay. So they are related posteriorly to the rectum. Okay. So while in females we have more relations. Okay. We say that it is related to the sacrum, coccyx, piriformis muscles, coccygeus, levator ani, and sacral plexus what posteriorly. That's in females. So we are done talking about the posterior relations of the rectum. Let's talk about the anterior relations of the rectum. We say that the anterior surface and lateral sides of the superior third of the rectum are covered by the peritoneum in both sexes. Okay, the anterior two third covered by peritoneum. Okay, you see the peritoneum in green around it. Okay, then middle third has anterior peritoneal covering only, while the lower third has what no peritoneum at all. Okay, you see down here there is no peritoneum at all. Okay, so I hope you guys are following up this lecture. Next, let's talk about we've spoken about what the anterior relations and the posterior relations of rectum. Let's talk about the blood supply to rectum. Okay, so basically we'll be using the arterial blood supply to actually still map out the venous drainage, okay, of rectum. Now the rectum receive arterial supply through three main arteries, and these arteries are the what superior rectal artery. This is superior rectal artery. Um, the superior rectal artery is a terminal continuation of the inferior mesenteric artery. Okay, it's a continuation of the what inferior mesenteric artery. You see the mesenteric artery giving up uh this branch that becomes the superior rectal artery. Okay. And next we have the middle rectal artery, which is a branch of the internal iliac artery. Let's trace it out. Middle rectal artery. I see here it's a branch of the what internal iliac artery. And next we have the what inferior rectal artery. Let's trace it out. This is the inferior rectal artery. Okay. The inferior rectal artery is a branch of the internal pudendal artery. Okay. Then you know that definitely at most places, um, the venous drainage accompanies the arterial drainage, and they have the same names. Okay. So in this case, it will be superior rectal vein, middle rectal vein, and what inferior rectal veins. Okay, so as the arteries are flowing to, the veins are flowing back, okay, carrying the oxygenated blood. Okay, that's the blood supply. We also spoke about the anterior relations of the rectum, and we also spoke about the what uh, blood supply to the rectum. Okay, so with these guys, we'll just close this chapter. We are doing so much on rectum. We did so much on abdominal anatomy. Okay, I'll see you guys in the next tutorial. And bye for now.